Well, for more analysis, I'm joined by our health editor, Julia Seeger. Welcome to Julia.
Hello.
A health pass rather, is now in place. That's not going to be enough, is it, to put the brakes on the sorts of numbers of daily infections we've been seeing, is it?
Well, it's not in place yet, but it's being voted on as we speak. I mean, they're still debating about it, and parliamentaries are still debating on it. But among the measures that were outlined by the French Prime Minister yesterday, several seem to be actually quite illogical, given the epidemic situation in France. For instance, they announced the canceling altogether of the self-isolating period for people who are fully vaccinated, who've been in close contact with someone infected, and who also test negative to COVID-19. And the reason why is because, according to the data that we're getting from Israel right now, it's believed that people who are fully vaccinated tend to less transmit the virus because their viral load is weaker. And that said, of course, as you know, they can still contract it and transmit the virus. But another question that we have is whether or not they are more asymptomatic because they have antibodies, which would make them harder to trace. Now, the other measure that's part of the sanitary pass is enabling people to take off their masks in certain indoor areas. They have to be either fully vaccinated or show a negative PCR test, and we know that both of those solutions are not 100% accurate. Now, these two measures seem completely illogical if, of course, your end goal is to try to reduce contamination rates as much as possible. But at the same time, it makes sense if your goal is to try to push people to get vaccinated as much as possible, showing them that they can go back to a normal life if they've gotten the jab. Now, are they good measures? Is it a good strategy? This is not for me to tell, but what's for sure is that authorities have to establish what's called an acceptability threshold. So that's the number of deaths and hospitalizations you think are acceptable. And for that, you actually need to have a very good idea of what's happening on the ground.
Okay, and just give us a sense of what the situation is like in hospitals across the country.
Well, precisely. We know as of today that there's an increase of 33% in ICU hospitalizations across the country. That's not homogeneous. There are certain clusters, of course, in and around Paris and Corsica or the Pyrénées-Orientales. Younger people seem to be more affected, but we don't actually have a really good idea of the type of profiles of people who are entering ICUs today. And one of the reasons why is because you have three different databases that exist since March 2020, one that identifies people who have died or who have been hospitalized because of COVID-19, one that collects PCR tests, and another one that really traces all vaccine injections. And none of these three databases are linked together, so it's very complicated to really understand what is happening on the ground. It would definitely help us very much if that was the case.